What do you do if you think you've had a concussion or you know you've had a concussion? Well, there are two possible scenarios. First, we'll talk about the acute phase after a head injury, and then we'll talk about some of the chronic or long-term consequences after a head injury. So what do the guidelines say about an acute concussion? One of the first things that you have to do is you have to remove the possibility of worse pathology. So that means things like brain bleeds or more severe brain injuries. So if someone takes a head injury and they've lost consciousness for an extended period of time, they're having worsening headaches, they're having abnormal pupil dilation, so that means one pupil is abnormally large or abnormally small, or they're showing signs of seizures, and that's an indication to go to the ER. They're likely going to get a CT scan to rule out some sort of brain bleed. They're also going to be evaluated for more severe signs of brain injury or anything like a cerebral spinal fluid leak. If they show any signs of neurological instability, then they're probably going to be admitted and they're going to receive care until they're neurologically stable. Now, if someone takes a head injury, they're dazed, confused, they have a headache, they're a little bit dizzy, there's no focal neurologic deficits, and they're considered stable, then they're going to rest for anywhere from 24 to 48 hours and get recommended to see a doctor the following day to manage acute symptoms. And this is usually going to be with a neurologist or some sort of concussion specialist, especially in the sports related fields. After that, then a lot of people are going to recommend to start to slowly initiate movement. This can include walking or very light physical activity within 48 hours, specifically with a doctor recommended or supervised exercise type regimen. Now, once the person is neurologically stable, it's pretty normal for patients to continue to have head injury symptoms for 15 to 30 days, and many patients will get better even without too much treatment. Now, this doesn't mean that they shouldn't get treatment because there is evidence that suggests getting early cervical and vestibular rehab with a chiropractor or a physical therapist actually improves outcomes and improves the ability to return to school, return to sport a little bit sooner than patients that don't do anything. So getting therapy early can actually be quite helpful. Now, if you still have symptoms beyond that 15 to 30-day window, then the neurologist or sports medicine physician may want to consider getting that cervical and vestibular rehab if they haven't gotten that already, or addressing speech problems with a speech therapist, addressing visual problems with vision therapists or neurooptometrists. And then there's obviously the neuropsychological and cognitive components, which can be managed by a psychiatrist or a psychologist. While those are the guidelines, I do recommend that you see someone that has a lot of experience managing patients with post-concussion issues, because a lot of concussions may need individualized treatment to address their individualized presentation with some of these brain injury problems.